remember that when we study public health, we see that there are health disparities, so that the adverse effects of a public health situation, you know, they're felt more by vulnerable populations like babies or old people or immune compromised or poor people, you know, that like can't afford air conditioning or whatever the issue might be. So it's something to think about. There's a social justice kind of component to health because of health disparities. So here's kind of the fun part. Take a look at that at the bottom, 1 million deaths a year caused by mosquitoes. And you see that sort of goldy orange part that includes North America, that's, I think, West Nile virus. So, we have, we've been feeling in the United States for the last 10 years or so a virus that a lot of people get and don't know it, or they get a mild fever or aches, but it has led to some deaths in the US, and it's mosquito-borne. And then deer ticks carrying Lyme disease. Well, here's the Lyme disease range right now. Well, Lyme disease used to be thought of as like in Connecticut, but it's gotten really into Wisconsin a lot in the last 10 to 20 years, and you can see it's definitely strongly moving into the UP and also some places in lower Michigan on the Lake Michigan on the western shore. You can see our western UP counties there that are in the red. Those are ones where we've had lab confirmed Lyme disease, and that goes into our state surveillance system called Michigan Disease Surveillance System, MDSS. So when there's a laboratory confirmed report of a disease, then it goes into a state database. And so we know that we're seeing Lyme disease in the UP, and you know, that's just kind of like tip of the iceberg. So there's probably a lot of people that have had effects of Lyme disease and they didn't know, and they thought they just had an undiagnosed virus or a chronic fatigue or something like that. And I know that it's an issue with healthcare providers, educating them and raising their awareness right now that, you know, maybe that should be one of your first thoughts and not one of your last thoughts, because it's treatable with antibiotics. So, you know, those big kind of flat ticks that you pull off of your dogs that we've seen for like 10 or 20 years up here, like down in the Chassel Sloughs or someplace, those are the, what do we call those, wood ticks or dog ticks? But this is the smaller ones that are harder to find, unfortunately, those black-legged or deer ticks, the ones on the lower left. They're really hard to see, and they can be on you for a while, and they say they have to be on for 48 hours for you to have the Lyme disease transmitted. I don't think that's true. I think that it can be just on you for a little while, and you can be at risk for the disease. This is kind of interesting. I'm going to finish with a couple of slides on mosquitoes, because we know mosquitoes carry malaria and other killing diseases. And this is the range in the United States of two species, the Aedes aegypti and the Aedes albopictus, that carry Zika. Now that doesn't mean that if you got bit by a mosquito in Iowa or Illinois or Indiana or Ohio that you would get Zika virus. It's just the species that's able to carry that virus and transmit it to you. Now, mosquitoes don't fly around the world. They didn't come over to Brazil with the Zika virus from, Africa. The virus is carried by people, and then when they're bit by the local mosquito population, it infects that local population. So we saw Zika this year spread to Puerto Rico, and then into some neighborhoods in South Florida even. But the important thing I want to say here is that when you look at the range of these mosquitoes, and you can imagine these particular species surviving farther north with climate change, that would put Michigan at risk for whatever diseases they can carry. So there's that albopictus range. It's getting pretty close to us already. And when you look at that range of that particular mosquito, look at that southeastern United States and how red that is. So the density or the probability of finding those mosquitoes there. Notice that, where are the other places like Brazil, Sub-Saharan Africa, and China? Those are places we think of as breeding grounds for tropical disease. And then you see the United States. A lot of us have this picture of the world where we think the United States is on the same latitude as Northern Europe, and that's not true. If you go on the same latitude from Boston and go across the pond, you end up in Madrid, Spain. So most of what we think of as right next to us on our mental map is really at the latitudes of Canada. And so my point here is that as Michigan weather becomes milder, we're going to be at risk for those diseases that you think of as tropical diseases.